Hello, we are going to be doing an industry definition and analysis of the weight loss industry through the perspective of United Healthcare today.
Yeah, so I'm going to be talking about the industry overview of the weight loss therapy industry, which is an industry with multiple firms that offer products and services to customers who are looking to lose weight for aesthetic and health reasons through surgeries, medications, or workout regimens. These firms include health insurance companies, pharmaceutical companies, and weight loss program companies. And United Healthcare is a health insurance company satisfying customer needs by providing coverage for weight loss remedies. And now looking at the key players of the industry, some direct influencers are healthcare professionals, healthcare insurance providers, surgical centers, and pharmaceutical companies. Some indirect influencers are gyms and wellness providers, digital health tech companies, nutrition companies, and weight loss consultants, which are all heavily regulated by government and regulatory agencies. Now, looking at the barriers around the industry, there's regulation, access to care, professional medical knowledge, cost, stigma and perception, technological advancements, innovation, and scientific research.
Starting off with competitive rivalry, we've identified the competitive rivalry as being somewhat moderate just because there are very few insurance companies present in this market. However, these insurance companies are extremely large and have a lot of power. Moving on to supplier power, we've identified suppliers as being the drug companies and medical instrument companies who provide the tools utilized for the things that insurance companies are providing. We've identified this power as being high just because there are a limited number of these companies, so they have the ability to set their pricing as high as possible. Moving on to the threat of new entry, we've identified this as being other insurers, and we've identified this threat as being extremely low just because of the high barriers to enter into the market, including high capital requirements and the need for an intricate network. Moving on to buyer power, we've identified this power as being extremely high because customers have the ability to decide which company they'd like to get insured from. And lastly, for the threat of substitution, we've identified this threat as being very low simply because many of these substitutes are also viewed as complements just because the things that insurance covers, such as weight loss, surgeries, and medication, can also be utilized with weight loss programs. And also, United Healthcare provides access to weight loss programs.
Looking at industry profitability through the Five Forces lens, we can see that suppliers have a substantial portion of the profitability within the industry compared to intermediaries and other substitutes and complements. It's important to note that within the drug industry, drug sub industry, we're talking in hundreds of billions versus surgical procedures, which are in the tens of billions. So for intermediaries, even if you see lower profit margins, they're on a substantial amount of volume. But like I said, we do see suppliers gaining the most profits and then followed by intermediaries, which are insurers and pharmacy benefit managers. And lastly, moving into substitutes and complements, we see that the profitability in these traditional weight loss programs has really decreased, and it's moving towards the weight loss drugs, because even companies like Weight Watchers and Noom are entering into telemedicine to prescribe these weight loss drugs. So that's why we see it as more of a complement, these companies as more of a complement than substitute.
Moving into the pestle analysis, we'll start with the political factors affecting this industry. Mostly it's going to be government regulation through the FDA and the Center for Medicare and Medicaid Services that are regulating what drugs and surgeries are available to consumers. So they're the catalyst for this industry. For the economic factors, there are high costs due to rising inflation, and just in general, these drugs and surgeries are expensive, and they will put a financial burden on the healthcare system. For the social factors, so certain sociocultural views through TikTok and celebrity influencers have caused people to jump on the GLP-1 drugs. Approximately 40% of people who are not diabetic are on Ozempic because they've seen certain things regarding the miracle weight loss drugs through these apps. Through the technological factors, there's been certain tech disruptions due to increased methods of getting GLP-1 prescriptions through telemedicine and artificial intelligence, which has made it easier to have access to these drugs. So the industry will have to adapt quickly. For legal implications, certain insurers are refusing to cover weight loss drugs, like in Washington State, where an employee sued a government agency that manages her health insurance because they would not cover the weight loss drug. And lastly, for the environmental factors, high GHG emissions from drug manufacturing could lead to regulation and increased costs for these insurers.
Moving on to what we think is the most important factor within PASTEL, which is political and legal uncertainties. These are mostly influenced by the FDA and the CMS. More specifically, currently under Medicare, it is not any of the GLP-1s are not covered under the Part D basic coverage. Within Medicaid, most of it is covered by state, and currently only a very few amount of states are covering GLP-1s. In terms of potential regulatory changes in the future, the Congress could expand the coverage based on some of current studies from Novo that shows GLP could decrease chance of heart attack and stroke, and some potential backdoor provided by Lilly's study where Medicare and Medicaid coverage will be mandated to cover the GLP-1 drugs because of their ability to treat sleep apnea. Going on, this high regulatory uncertainty alongside with high consumer demand, high claim costs for insurance companies, and high costs for employers who cover these drugs, who chooses to cover these drugs, lead to a range of future uncertainties for United Healthcare into the future. And due to the high demand, the coverage for weight loss drugs are unavoidable into the long-term future. So employers who are facing high spikes in cost, as well as United Healthcare as an insurance company also faces high spikes in cost. Specifically within high demand, there's 40% of US adults that are obese, and employers who are looking to cover these drugs alongside insurance companies is about to double in the next year. In terms of cost, Wegovy, as an example, costs about $16,000 per year, and based on expected spending on GLP-1s alone, it will be around $50 billion, which will be more than 1/10 of entire US outpatient drugs cost. This leads to the strategic posture currently that UH is taking is essentially a low coverage combined with staying put on future statements. And potentially moving into the future, what could help United Healthcare cut down their cost is by cutting down current costs or preventing future cost. In terms of current costs, they can provide a very strict plan policy for the additional Plan D add-ons in terms of requiring certain patients to spend at least 3 months complying with a dietary and exercise program before receiving their GLP-1 drugs, or allowing only certain doctors to prescribe these drugs, or for insurers who are also bearing a big chunk of this cost, require documentations of their employees for eligible body mass index or previous weight reduction efforts for a condition of authorization. For future preventative methods, UH can also lobby on continued ban on Part D coverage, basic Part D coverage on any weight loss drugs due to previous regulations. And thank you for listening. We're open to any questions.